Turning now to the coronavirus, newly released documents suggest the FDA will approve Pfizer's coronavirus vaccine for emergency use authorization on Thursday. The documents posted on the agency's website state the vaccine meets its criteria for success. Research data shows the vaccine was 52% effective after the first dose and 95% effective after 2 doses. The vaccine also did not raise any specific safety concerns. If emergency use authorization is granted, Pfizer could begin shipping vaccines by this weekend. The news comes as the UK begins giving out the same vaccine, and America reaches nearly 15 million cases and more than 283,000 deaths. Several states are considering or have already implemented new restrictions as hospitalizations have reached new levels, including here in Georgia. This afternoon, Governor Brian Kemp is giving an update on the state's fight against the coronavirus. But like many other states, health officials warn our hospitals may soon run out of space. More than 2,500 people are actively seeking medical care for the virus. After peaking again last week, the Georgia Department of Public Health reports that Georgia was up more than 4,800 new cases yesterday. That is now our second highest date since the pandemic began. Joe Ripley has more on proposed solutions to the shortage.
Amid progress on the vaccine front, Georgia hospitals are now bracing for an increase in COVID-19 patients. A post-holiday spike in cases led to an increased demand in testing. The surge also has medical staff worried they might not have the personnel, resources, or space to handle the expected influx of hospital patients.
We're already at about 84% of our ICU beds in use right now. And so we just want to keep an eye on what's going on with those hospital admissions.
Georgia recorded its highest number of hospitalizations, just over 2,500 since August 20th, a 30% increase in the last 2 weeks. ICU bed availability is dropping dangerously low in suburban and rural parts of the state. Dr. Robert Jansen, Chief Medical Officer of Grady Health System, says the ripple effects strain an ongoing nursing shortage and has put already postponed elective surgeries at risk.
We are now at the point where we are closely monitoring on a daily basis the number of patients that we have holding in areas. And if we surpass that, then we'll have to start canceling patients who come in for elective procedures that would require inpatient care.
Grady Hospital is considering building an outdoor emergency unit to handle COVID-19 patients. Staff there and at Piedmont Health System are also working with the governor's office to get access to additional resources. Wellstar Health System has seen a surge in patients as well. It says it plans to increase the number of staffed ICU beds as needed to meet increasing demand. Health experts say hospitalizations usually lag a couple of weeks behind case spikes, and then deaths generally follow after that, about a week later. Health experts recommend to limit the spread, wear a mask, wash your hands, and social distance.
Georgia's governor and state top health officials are offering an update on the state's efforts to prepare for vaccine distribution. That is happening at 1 p.m. today. Look for the live stream on 11alive.com, our app, and on our YouTube page.